This is Dr. Wood. He's one of our medical directors here at Universal Surgical Assistance. Dr. Wood, your group is very large in covering major hospitals. Please explain your coverage in these facilities.
Well, I'm a partner in Southwest Surgical Associates. We're a group of primarily general surgeons with 19 physicians, and we cover 10 hospitals in the west and southern parts of Houston. My practice is basic general surgery. We do general surgery procedures, minimally invasive laparoscopy, as well as trauma.
Who are surgical assistants and physician's assistants?
Well, those two groups are people that help a surgeon in his care in the hospital, in the office, in the operating room. PAs or physician assistants can help us see patients on the floor, see patients in the emergency room, see patients in office, and they also will help us in surgery. Surgical assistants are people that help us just in the operating room with surgery.
What specialties do physician's assistants and surgical assistants cover?
They will cover all of the surgical subspecialties. They can cover general surgery, neurosurgery, orthopedic surgery, plastic surgery, vascular surgery, basically any specialty where the surgeon is willing to have them help.
So what are their educational backgrounds?
Well, physician assistants attend 2 years of PA school after college, and they are licensed by the state of Texas. Surgical assistants are also licensed by the state of Texas. Many of the ones that I work with have been physicians in other countries and then come here to America and work as surgical assistants. The ones that do not have that type of background can do additional training, sometimes in the 1 to 1.5 year range, prior to becoming licensed by the state of Texas.
Let me bring up the topic of foreign medical graduates working in the United States as physician's assistants and surgical assistants, and how do they help you?
Sure. Many of the assistants that I've worked with have received their initial medical training in another country. I've worked with people that have been primary care physicians and even some that have been surgeons in their home countries. And then after moving here, they choose to work as surgical assistants. From my standpoint, it's nice in that they will have additional medical training beyond just what's required for licensure here in Texas, but also some of the surgeons or people who trained as surgeons in other countries have a significant amount of extra training so that they understand the operations we're doing so they can provide me with a higher level of service in the operating room.
What is your experience with Universal Surgical Assistants, and how do you find their expertise in surgery?
I think they're great. Whether it's the licensed surgical assistants or the PAs, they work very well with me in the operating room. It enables me to do a better job in surgery. It's no longer relying on just my two hands. Now we have someone who knows my routine, knows how I do surgery, helping me with the operation. In addition, the PAs, when they help me outside the operating room, it allows me to see patients in a more timely manner. It allows me to get things done more quickly and provide a better level of service, not just to my patients, but also to the hospital in which we're working.
Thank you so much, Dr. Wood, for sharing your experience with us today.